Endometriosis. This is probably the number one issue that personally I see patients for with cannabis. It affects 10% of women worldwide. And the symptoms are severe pain during periods, during sex, or when you're going to the bathroom. So severe acute pain, in addition to just chronic pelvic pain. A lot of these women are in pain all the time. They experience bloating, nausea, fatigue, depression, anxiety, and infertility is one of the, biggest kind of symptoms or signs of endometriosis. It can be hard to get a diagnosis. You often have to be operated on, and they have to actually visualize it. It's hard to see this on scans. And, I've had patients that had over a decade before they could actually get their endometriosis diagnosis. I think we're getting better at this in the medical system, but definitely advocate for yourself. If these symptoms sound like you and you're kind of, not being taken seriously, maybe seek a second opinion, because it's common and it's debilitating and it's progressive. So the other thing that we know about endometriosis is it can be associated with a clinical endocannabinoid deficiency. So as we're talking about this endocannabinoid system and the three parts, which is the cannabinoids or the endocannabinoids we produce, the receptors they act upon, and the enzymes that break that down. So there has been evidence showing that women with endometriosis have lower levels of cannabinoid receptors in their uterine tissue. And they also have, often lower levels of endocannabinoids in their system. And so this impaired function of their endocannabinoid system, or reduced endocannabinoid tone, it's referred to sometimes as, it's associated with increased pain and increased tissue growth, because that's the issue. With endometriosis, there is endometrial tissue that's supposed to be on the inside of the uterus growing outside of there. So some of these women have severe back pain. They can end up getting appendicitis, and it's actually endometrial tissue wrapped around their appendix, causing the appendicitis. So it's an invasive condition. And this endocannabinoid deficiency, it's associated with more advanced disease. So I really like with this a layered treatment. As I was saying before, CBD, think of it as that supplement, that agent that can help improve endocannabinoid tone. It increase the number of receptors in the uterine tissue and increase the amount of endocannabinoids that your body's producing. Now, that's not something that you can just take CBD once and it helps. Think of CBD like a vitamin that you take every single day. That's when you're going to get good results. I see people start, it works in a subtle way, and it takes time for its action to build up and really be seen in the body. Give it 30 to 60 days of regular use. Then you'll know you really gave it a shot with CBD. So, I like to, remind people of that you're not going to maybe notice the full effect right away. You need to give it some time. But that's because it's helping your body do its job better. So over time, you're going to start feeling better. And then THC is wonderful for reducing our perception of pain, relaxing muscles. So that can be really helpful for this. So with these patients, I tend to see a regimen that involves both compounds, daily use of CBD for sure. Some people use THC every day as well, and definitely using THC for breakthrough pain and other symptoms like that. But it can be an incredible treatment. And because we're finding out more of this endocannabinoid deficiency, it's certainly worth a trial. If you have an endometriosis diagnosis, giving a cannabis, a cautious trial is a good idea.